Turning on. Okay. So I'm Evelyn Boche. I'm a senior program coordinator at the National Black Leadership Commission on Health, where our mission is to champion the promotion of health and prevention of disease to reduce disparities and achieve equity in Black community. So today's webinar is on the national overview of maternal health. And I will let our panelists introduce themselves as they will also be speaking about reports on maternal health that draw very close similarities to maternal health disparity in New York and also in Texas, and we draw a national overview of it. So today's objectives are participants will gain skills to engage more effectively in maternal health advocacy. Participants will learn that Black maternal health disparity is seen nationally. And lastly, participants will act on advocating on maternal health policies. So without further ado, our panelists, we have Ms. Masha Jones, Executive Director of the Afire Center. The Afire Center is our partner in on these three-part webinar series, where we had the first webinar series last month. And those that did join us last month, we had feedback and we had messages from you. So we are happy you returned. If you are also new and this is the first time you are joining the three-part series, the next session will be in June. We will send the flyer and the link out for you to register. And then we also have Reverend Janine Robinson, is the Policy Director at Afire Center. So I will welcome them for today's webinar to start. And thank you once again for joining us.
Good afternoon. I will start. As you said, everyone, I am Reverend Janine Robinson, the Policy Director for the AFIA Center. It is my joy and privilege to be with you all this afternoon. I am looking forward to our discussion on advocacy as it relates to maternal mortality.
I just want to, I'm struggling here, y'all. I've been having some technical issues since we've been here. My sound left just a minute ago. So we are introducing ourselves, correct? So I'm Marsha Jones, and I'm the Executive Director of the AFIA Center. The AFIA Center is a women's-centered reproductive justice women's-centered organization. We're located in Dallas, Texas. And our goal is to transform women and girls' relationships with their sexual and reproductive health. And in doing so, we advocate around issues that most impact Black women's lives in the state of Texas, and with the hope that it impacts the lives of Black women across the United States and globally. And we do this work by way of advocacy, community education, policy advocacy, and just generally bringing awareness to many of the issues that often are not spoken as it relates to the impact that it have on Black women. And most importantly, we use a reproductive justice lens to do this work. We find that it is very important that we've understood that when we are talking about the lives of Black women, it is not a single issued focused thing. And so it would be impossible to do this work single issue driven. So we don't have the luxury of just looking at HIV, just looking at maternal mortality, just looking at access to abortions, just looking at any one issue that impacts Black women's lives. It is very important that we do this work intersectionally. And so that is the way we've done this work at the AFIA Center historically, and we continue to do this. So I'm really looking forward to this continued discussion around maternal mortality and talking about the health and wealth of our birthing folk along with the folk that they're birthing.
Thank you, Masha. Thank you so much. So we will start now. If you we'll talk about the report from last year and this year and just show the similarities. Then Reverend Deneen could talk about the policy and aspects parts of it for now.
So ideally, I thought we were going to share the conversation around the report because we didn't do the New York report. New York did the New York report. But
yeah,
there are
had the
some,
emergency.
I think, so for us, so when we look at what's happening in Texas, so I'll start with what I know and I'll move forward because I think that it makes more sense for someone else to really intimately talk about what's happening in the space where they're at. But anyway, here's the thing. When you're talking about Black women, and it's like I said in the beginning in my introduction, when you're talking about Black women, be it Black women in New York, Black women in California, Black women in Texas, Black women in Oklahoma, it doesn't matter, Black women outside of this country, the things that impact us will be similar because it's not necessarily what resources look like for us individually. It's not necessarily whether a state have access to Medicaid, whether that state don't have access to Medicaid, because the access to Medicaid or whatever, that is just the small piece. The problem is how Black women are treated because they're Black women. So because Black women is because of internalized racism, it is implicit biases. It is these things that impact how Black women fare in the healthcare systems than any other system. So the reason that the report in New York don't look so much different as the report in in Texas, is because we're talking about Black folk. And we're talking about the systems of care that Black folk enter. And we're talking about how these folk are treated when they enter those systems of care. So that is why these outcomes look the same. So the data, when we look at the overarching numbers of Black women who are still, I know for the Affairs Center, we started attacking this probably in 2013. Wasn't even a lot of people really talking about it. I noticed when we did our first small report on maternal mortality, it was like, I believe it was 2013, either 2013 or 2015. People in the room, and we were talking to legislators, they didn't even know what we were talking about. They not even talking about it. And Reverend Robinson she will talk about, I'm sure, I can't tell you what she'll talk about, but I'm sure the data she will talk about how the Black women and maternal mortality, the numbers have been going down and down and down and down. So this is not new. I believe a couple of last week when we were preparing for this show, I was having a conversation with Reverend Robertson about 4 years ago, and it dawned on me that my father's mother and his mother's sister died having those two children, and their aunties had to raise them. And then my grandson's mother died eventually from complications that was identified when she was pregnant with her son. These are things that should have been seen long before then. So the reason that we had to write this report, and so many other people are writing this report, and the reason that New York's report don't look that much different than the report that we're doing in Dallas, the reason that Black women are dying at such disproportionate rates, Black babies are dying at such disproportionate rates, is for 100% around racism, genderism, how we see Black women when Black women come into these spaces. It is the erasing of our humanness, how people allow Blackness to erase our humanness. And that is why we're treated, but we can change that. The reports are necessary. I believe that the report that's done in New York, report that was done in New York raised racism as a key factor. the numbers were continuing to go higher and higher. That was a key factor, just like in Texas. They also identified that, I believe that we also, both reports identified that doulas, having doulas will decrease these help these deaths. But also, how do we pay these doulas? How do we sustain these doulas? Will Medicaid sustain? Will Medicaid payments sustain their lives? Will Medicaid pay the money that it takes for having a doula? For visits, Medicaid paying for 4 visits. I'm not sure what New York's Medicaid will pay for, but I think what they're talking about in Texas is paying for 4 visits, 2 before and 2 after. You cannot take care of the mother's needs with two before and 2 after. I just recently worked with a doula, and I started working with her at 28 weeks, and I'm still kind of sort of working with her. And her baby's 3 months old now. Postpartum doulaing. But anyway, that was one of the things that was raised in the New York's report, as well as in the Texas report, and that was making sure that folks had access to Black birth workers, Black doulas, Black midwiferys. And then there's a ceiling when we're talking about Black midwives. So the team. And no, we're not. Well, we could say that, and we're not saying that Black people can save the world. We know we can't. But what we're saying is that when Black folk are in these spaces with other folk birthing, the outcomes are different. The birthing outcomes are different. And that is what's important here. And that is the thing that the New York report states as much as the Texas report state, and that our legislators have to do more. There's got to be stronger policies. And so as I move on to talk about because I think my part is to talk about the what and the how. The what is, how do we get policy? How do we get policy leaders how do we get policymakers to hear us? We get policymakers to hear us when the folk who are electing the policymakers sitting in the office are talking to the policy people, right? So as long as the people who are voting for them to be in office is not saying anything about the policies that they're putting in place, they're pretty much not going to be too inclined to change those policies. And so we have to join together as community and do more advocating. We can't just do advocacy when our legislators are in office. We have to do legislation year round. We have to talk to the people in our communities. Everybody may not feel like they have a voice in the halls of not the halls of justice, but when in the legislative halls. But yes, you do. But if you don't feel like you have the power to do that, then you need to talk to the people that you know best. Talk to the women in your community. Talk to the people in your church. Talk to the people in your family. Black women are still dying. Like, we have to say it. It don't sound good, but it is the truth. Black women are still dying. Black women are still dying at a much higher rate than white women. Black women are still dying at a much higher rate than any group of people who are birthing. In 2021, Black women are still dying. Enough people don't know about doulas. How do we talk about doulas? How do we talk about that this is available for women? But we also have to talk about, how do we pay the doulas? So talking about maternal mortality, sharing your stories. We have birth stories. Sure, just like I shared my story at the beginning, my father's mother died in birth work. Yes, I know this was 100 years ago, but still, this let us know that this is, I thought my dad would be like a little over 100 now if he was alive. He was born in 1915. But yes, it happened. So that's just letting you know this has not been a thing. So we need to tell our stories. We need to talk about, and let's remove the shame, because that's another thing that contributes to some of the things that we're talking about. It is the shame that's attached to the reproductive choices that Black women make. whether we have too many children, not enough children, but just that shame of talking about it. There's shame attached to miscarriages. There's shame attached. So we've got to remove the shame. And we only remove the shame by telling our stories. So we've got to talk about it. It's painful. Yes, it's painful to talk about death, but it's even more painful to keep experiencing death. So we've got to talk about it. We've got to tell the stories. We've got to tell the stories in groups. We've got to tell the stories in church. We've got to tell the stories in the legislative hall. We've got to tell the stories. And we've got to demand that our legislators put forth policy that makes sense. Because the current policy that we have in Texas now don't make sense. Yes, I'm sure Reverend Robertson is going to talk about what's happening right now. It looked like we may pass legislation that says that birthing folk will have access to Medicaid for 1 full year after birthing or having a miscarriage. That's good. That's good. But it is not enough. It is not enough. We can't settle. We just can't settle. Settling get us where we are now. 2021. I'm talking about my father was born in 1915. And he was born in a family with resources. And we're still talking about people dying, people unnecessarily dying. So those are some of the things that I think that happened in the report, and I will get ready to end with that. Those are some of the things that crossed in the report, and it is in New York, where you would not think that we were having these issues, right? We're talking New York and in Texas. And I always said Texas being this filthy, vulgar, resource-rich state. The same group of women are dying. The same group of people are fighting for policies to change the outcomes of the lives of the same group of women. We're talking from one end of the spectrum to the other. New York, name so great they said 2 times, right? Dallas, or Texas rather. Texas, the Lone Star State, where everything's better and bigger in Texas. But things are not so great for Black people birthing in New York. Things are not so much better for Black people birthing in Texas, because in both of these states, people are still dying. People are still dying. And it is Black birthing people who are dying. We've got to advocate. We have to speak up. We have to talk to our friends. We have to talk to the people in our communities.
Yeah. So
that we can change the outcomes. Because that's what's going to do it. The policy people can do all they can do. But when the community people start demanding change, when the community people start saying, you know how we took the streets when George Floyd got killed? And everybody and their mama's mama now have a law, a George Floyd Act. The legislative, the federal government is trying to put forth because people said enough is enough. Just imagine what would happen if we felt that way about Black women. Just imagine. Just imagine if we felt about Black women the way we felt about George Floyd. Because we've been standing out there screaming, saying, they killing us, they killing, Black women are dying, having babies. And so in my ending, I last year, one of the people running for city council in Dallas, he had put a thing on his page, his Facebook page, and he was inviting people to meet us in Austin. We're gonna have this police, I don't know if it was reforming or defunding police. We wanna bring all the people in Dallas I'm gonna pay for buses myself. We're going, and I responded to his page and I asked him, I said, wow, I would love to have seen this kind of excitement around following us to the Capitol to demand that they put policies in place that would assure that Black women stop dying in birth. And do you know, he never even responded. It was just like, I didn't even respond to his response. He responded to everybody else though. All the other people were saying, count me in, I'm gonna be in Austin. He never responded.
Maddening.
That's what we're facing. And that is why Black women are still dying. There's not enough of an outcry. And so we've got to cry out. So that's my part. Yeah.
So thank you, Marcia. That was a huge setup there to follow. So, but I want to start with this. What you said reminded me of something that we learned when we produced our report in 2017, and then again in 2019, and then it's still the same now. There are no protections for Black birthing people. It doesn't matter how much money you make. It doesn't matter where you live. It doesn't matter your access to health care. It doesn't matter what your family name is. Doesn't matter how many degrees you have, whether you have health insurance or not. None of those things matter. There are literally no protections. And I'm reading over the New York data and thinking about the Texas data. The data demonstrates that. When we first started looking at this in terms of the data and the science, we just knew that these people were going to be poor and had bad diets and were doing all these negative things that were putting them at risk for experiencing maternal mortality, when in fact, what we discovered is actually no, about half of the people in Texas and the same in New York had private health insurance. So they were not all on Medicaid that were dying. We have seen reports that folk who were physicians and actually studying maternal mortality had the same health outcomes, meaning that they died in the same way as that person who was on Medicaid and died shortly after 42 days. And so the outcry is absolutely necessary. And when it comes to policy, part of the challenge that we have the opportunity to overcome is, number one, the folk who are writing the policy don't understand the issue. And so that's a place where our outcry is absolutely necessary. We have to be talking to them. They know maternal mortality is a thing for Black people, but most often they result to the same conclusions that we did without actually delving deeper. And we have to let them know that no, there are no protections. This is simply racism. It is simply systemic racism and the ways that it causes us to be stressed out and how that stress impacts us internally by resulting in hypertension and gestational diabetes when we are actually in the process of carrying the baby. And so we have to deal with the external issues like how racism impacts us so that we can be in position to have successful health outcomes as it relates to having a safe pregnancy. The other thing that I want to say that's important is that we have hundreds of years of evidence that having a birth worker who looks like you, understands your story, is able to partner with you from the time that you discover you're pregnant and up to a year after your pregnancy, it has some protection as it relates to ensuring that you don't die or that you don't have to deal with the systemic issues like not being listened to or not being given the best care, because you have this other person that is partnering with you through this entire process to make sure that you are getting your needs met. So you're not having to bear the entire burden of the stress of going through delivery. And I also want to add that while we know that Black birth workers, doulas, midwives play a very important role, we shouldn't put this on them either. We need to deal with the systemic issues. And it's important that we always go back to that. When it comes for us in Texas, one of the things that's happening right now that Marsha lifted up is that literally in this right now moment, they are looking to pass legislation for maternal mortality, extending, and I want to use the word extending Medicaid so that birthing people are able to have health coverage beyond 2 months and actually for a full year. That is significant, but that is not enough in a state that has consistently denied that we need Medicaid to be expanded so that children get coverage, so that people who are working get coverage on the front side of their pregnancy to deal with the issues that potentially put them at risk for having a challenging pregnancy, and then have care long after the year so that they are able to remain healthy and raise their families. This year, while it is a Band-Aid, it's not a stop. It's not something that's gonna put us in place to thrive in this country. The other thing that's important as it relates to legislation is putting things in place to demand that our hospitals use the resources that they have so that they don't have to use their opinions when providing care. We have what are called AIM bundles, which are essentially kits that have been created so that if a person has high blood pressure, they don't have to think about, well, they're Black, so maybe it's their diet, or, well, they're white, so of course we need to treat them right away. None of those things are of issue. You go, you get the kit, use the kit, and take care of the person. They also have bundles that hospitals can use to respond to the racism, to respond to the poor treatment that folk are getting while they're birthing. And in the state of Texas, and I'm sure it's true everywhere else in the US, they're not mandated to use them. Part of the reason that hospitals are not using them is because they have to report the outcomes. And when you report the outcomes and they are negative, meaning you have births and people aren't treated well, or you have births and folk discover that people are dying in your hospital, when you have to report that information, then people may not use your hospital. So people aren't using these bundles because then the word would get out about the care that people are receiving in their institutions. And the other thing that is important is when a person is having a baby, the significant thing is not to focus on the child. You have to focus on the mother. And most often in those situations, the focus is on getting the baby here. And we need to have policies in place that are not so hyper focused on babies being born and then not caring for them once they get here, but policies that actually support Black women successfully birthing. And when I think about getting folk to Austin, we have folk rally around voting, and we need that. We have folk rallying around guns, and we absolutely need that. We have little rally around Black life. We have little rally around Black birthing life. And until we decide that the center of our community is important, we will continue to have the issues that we're having. There are things that community can do. When you know someone is pregnant in your community, there are things that you can do to support them. Go by, visit them, take them meals, help them with their children that they already have. When they come home from the hospital, be support for them, help them with groceries, come clean, drive them to take their errands. There was a study done in Cincinnati, Ohio, that said that one of the predictors for maternal mortality there was the transportation system. People who lived on bus routes and did not have cars were more likely to die birthing. Think about that. New York is a major city where most people don't drive. And think about the impact of having to go to an appointment after you've had a kid, all the jarring and on the train. We don't think about those things and how impactful that is to taking care of yourself after pregnancy. And the people that lived, like I said, on the bus route, they missed appointments. In Cincinnati, the way that their bus system works, they could be 10 or 15 minutes in a car from their doctor, but their bus routes were so convoluted that they would end up on the bus for an hour. And that was something that caused them, that they saw was related to folk who experienced maternal mortality and folks who did not. It's transportation. And so it's important that we, as people who have decided that we're going to devote our lives to Black women and whether or not they live well, is we have to call into account our neighbors, our friends, the people that we hang with, our spouses, our partners, to begin to show up for us and not actively work to carry the load for everybody. That's something that we all can do. And I'm going to stop there and see if there are any questions, comments.
So if I could jump in right quick, Evelyn, I'm surprised you missed this one, Deneen, when you were talking about all of the things. And I was thinking about when we talk about this work, and you were saying we need people to advocate around police violence. We need people to advocate around gun violence. We do need all that, but it is intersectional, because if we are all advocating around saving Black folks' lives, we'll see that all of this work hand in hand. And I thought about the report, the study that Dr. Jessica Roach was a part of with Roots.
Yes.
At Roots Birthing, that talked about the increase in maternal mortality in communities where there's more gun violence, where there's more police killings, where these things are happening inside of our community.
Yes.
That is how these things impact
each other.
Birthing and impact each other. So when we are working together, advocating to end these, I call them atrocities, that happen inside of our communities, we are working. I would never have thought about the transportation thing until that data came up. I was stunned when I heard Dr. Jessica Roach, when I saw that on her presentation about 2 years ago at Let's Talk About Sex. And they talked about in Ohio, I think it's Ohio, right?
Yeah.
They did a study where there was an increase in maternal mortality in these places where there was high prevalence of gun violence, high prevalence of police killings of Black folk inside of that community, high prevalence of police violence.
So what's interesting is we know about redlining. And if you don't, I'm going to briefly explain that. Redlining is where cities structure all the criminal activity, all the adverse things that happen in a part of a city. And then they all make sure that none of those things happen in any great magnitude on the outside of this area that they have concentrated all of these atrocities, because they are atrocities. The environmental things where they put plants, where they allow drugs to be sold. You know, drugs are happening in these neighborhoods, and police are driving down the street. And you're like, okay, so now if I see that and I'm not a sophisticated person, why are you not stopping that? They allow these things to happen in these areas, and they don't allow these things in other areas. Here's the thing that's interesting. That is a protection for every community except Black folk when it comes to birthing. Whether we live in the red line or outside of the red line, our birthing outcomes are going to be the same.
There's a question, I believe, for you, Denise.
Yeah, so someone asked, thank you. Someone asked, is how do we get a petition started when they want to already control abortion? So in my opinion, we have to understand that there is an absolute link between all of the things that are a part of us having comprehensive reproductive health care. The same people who we would see to get an abortion are the same folks who are at risk for HIV. They are also the same folks who may experience maternal mortality. And if we do not have comprehensive access to all of those things that we need, we are setting people up for sure to experience maternal morbidity and maternal mortality. Because having to go to a back room to have an abortion damages you so that when you get ready to have a kid, your womb is more vulnerable and you are more likely to die. So abortion access is necessary. And yes, the idea of a petition on the one hand may make them start targeting this more, but on the other hand, it's a way of us acknowledging that it is something that we need to be concerned about, putting things in place as a community, and then advocating for our policymakers to do more.
And I think that you're on to something. The question, when you say, how do we get a petition when they're already, so there's this need, this weird, our policy, not our policy director, but someone at the Appeal Center had coined this thing. There's this weird obsession that these folk have with our reproductive organs or reproductive choices. And I think you put them on the line when you say, okay, so you're saying, so you use it against them. That's what the petition do. You're saying that we cannot have abortions and you're forcing us to go through a full-term pregnancy. So we are holding you accountable to make sure that folks survive that full-term pregnancy.
Yes.
That's one of the ways we do it. We turn it against them because they can't have it both ways.
No,
they can't fight to take away bodily autonomy, because all of it is bodily autonomy. If I choose to carry full term, that is a choice that I should make, with at the end of that full term having the necessary resources to be safe, to be healthy, and also the person that I birth be safe and be healthy. And so, but if I don't want to do it, bodily autonomy says that I don't have to. But since you're going to bother into something that's not your business, then I'm going to put it on your plate. So if you are determined to take away my choice to not carry full term and to carry full term, then you need to use that same energy need to be put in place to make sure that it is safe all the way around. So taking that and putting it against them, using that.
Yep. And when they say, well, we can't do anything, then the account is, okay, then stop actively persecuting me by taking away my choices.
Exactly.
Because at the end of the day, so what people don't realize is you're going to pay on the front end or you're going to pay on the back end. There is always payment due. Mm-hmm. Always payment due. You don't want me to have this kid. Okay, I can't afford to keep the kid, so I have the kid. Now you have to pay for me to have the kid. The system has to pay.
or you don't want me to have this kid. I can't afford to have this kid. I'm forced to have it. I die, and the system still have to take care of
the kid. So either way, there's nobody gets an out.
Right.
No one gets an out. We are literally in need of each other. So I don't get to make legislation to make it your issue and I not have to deal with it. We all are literally in it together, whether we want to be or not. And that's why the advocacy is so important. If I can choose the advocacy on the front end and say, hey, this is what I need, this is what my community needs, this is what my children need, let's put some things in place so that this doesn't keep happening, then we can all have what we need and no one has to feel forced to pay. Does that make sense?
Makes sense to me.
Does.
We all have an opportunity and a responsibility to be present and available to help and support each other.
We will take questions. You could put your questions in the Q&A, but in the meantime, I'll just read Masha and Reverend Robinson. Could you put your contact information in the chat? I believe someone had put it in there earlier that for you to share your information. I also put the link for today's evaluation in the chat. Please complete the evaluation. It helps us to be able to form these partnerships like we have with Affairs Center to bring you more information like this, which is very much so needed and lacking in the community. So please complete the evaluation link, the form that I have put the link in the chat. What else? I'm just going through to see if there are any more questions before I read the comments. Okay, so we have put Masha's information in the chat, so please copy that for those that need it. And Reverend Robinson, I've also put hers in there, so that answers the question. So we have such a powerful conversation today. Let me see. This I also did not know until Reverend, you mentioned it, and it's also in the chat that you are so correct with the transportation issue, as well as the other environmental stressors. That is new to me and very alarming that that's actually happened in the United States.
So one of the things that I want to say is you hear us talk about systemic racism and racism being the ultimate reason why Black birthing people are dying. And we often don't make the correlation with racism to the health issues that we see. The majority of things that are associated with, majority of the deaths that are associated with pregnancy are cardiovascular related. So embolisms, pulmonary embolisms, also hypertension, gestational diabetes, all of those things are the result of external stress manifesting in the body as an impact on your heart. So being in this country as a Black person and knowing every day someone is gonna say something, whether it's overt, covert, a microaggression about your color, about your weight, about your hair, about just you being in the space with them, all of those things hit us, and they hit us as stressors. internally, they cause us to have our heart to work harder, because our heart is trying to manage us and keep us calm, right? So our heart is working harder. That result, the what we see is stress, and you have your stress, you have the generational stress that you inherited, which Dr. Geronimus calls weathering. And then as a pregnant person, as a birthing person, you have just the stress on your body of pregnancy. So you have this inordinate amount of pressure that results in these negative health outcomes, which is why physicians say to Black folk, you are predispositioned for diabetes, you are predispositioned for hypertension. What they should be saying is, man, if you could live in a world where you did not have to experience systemic racism all the time, you wouldn't have these health issues. It's important that we understand that that's not something that makes us inferior. It is something that we are experiencing because of this country. And the result is a sincerely, significantly negative health outcome on us when we choose to be pregnant. One of the other things that I want to add is there's been research done that has said that because of weathering, it's also why when teens choose to have babies, if they have babies in a safe environment, their babies are going to come out, they're going to do okay. The older you get, in your 20s, in your 30s, the more you are at risk for experiencing a negative outcome with pregnancy, because your womb and your internal environment is at least 10 years older than your white counterparts. So they suggest that we start teaching our young folk to repair their womb, to prepare their wombs for pregnancy in their late teens. Because by the time we get ready to have a baby, we're already having a geriatric pregnancy.
So what we got to do is we've got to work to deconstruct systemic racism, because that is the answer to, and it's so sad that we're having a conversation about maternal mortality that we cannot have without talking about racism.
Right.
Like,
right.
Seriously, we are talking about something that should be 100% medical.
Yes.
But it is not. It is directly impacted by systems of oppression, as you talk about weathering. We should not. It is the same thing as teaching our children before they leave the house, before they're 4 or 5 years old, how they need to interact with police. We should not have to teach our children that. What we should do is work to end and to deconstruct these systems of oppression. We need to deconstruct what systemic racism have done to this country and how it have impacted us. That is where the work is. As we get there, though, we do have to continue to have these conversations. We have to talk about what do it mean to, how do we create a space where we can talk to people before they go to medical school when we're talking about implicit bias? Because what we don't want to probably talk about is not only do white healthcare workers treat us indifferent, so do Black healthcare workers. Because again, we're not fighting the healthcare worker, we're fighting the system that created this. So the Black or the whatever doctors see us from the lens of the system that they were trained in, and trained them how to see us. So it's just really bad. So how do we, so that's one of the things we need to, that we talk about And that is also in this work. And what do? We work to end that implicit bias. We have to work to end implicit bias.
Yep.
Because that's what show up. There is this implicit bias that they already have about us when we show up in those spaces. And we need to talk about what implicit bias is and how it influences or directs how we see people. It's the same thing as you're walking down the street, I guess, and you see a group of Black boys. You change. Not only do white people cross the street, I used to cross the street because I had been conditioned to think that those young Black boys were going to harm me because they was walking down the street. I just assumed, So we can't change this. Our time is running out. We can, and so there's lots of conversations we have to have. We've got to talk about what's happening in our legislative halls. How do we change that? So this is a conversation around voter registration. This is about voter change, voter registration, voting, getting the right people to run, and then training them before they run. Because if we're talking about maternal mortality to the person who's thinking about running, this is already on their agenda. So they know it don't have to be either, or it don't have to be, do I fight to end violence, police violence? Do I fight to defund the police? No, all of this is the same fight. Do I fight to end HIV, high rates? It's all the same fight. And so if we're educating the folk who are running for office, if we're educating the small folk who are going to be police one day, if we're educating the small folk who are going to be doctors one day, if we're changing this system, and if we're working to deconstruct the system that we find ourselves in, we end maternal mortality, we end police violence, we end all of this stuff.
And ultimately, we end reproductive oppression.
That's our vision. It's a big one. I would say it's a Bill Gates vision, but being that he's gonna be split soon, it's bigger than him. I just have to always say stuff I shouldn't say. I keep telling people I'm gonna stop doing that, but
yeah,
that's it for me. I'm finna go.
It is a larger conversation, and it's not a conversation on its own. It all relates to each other, and we have to see it that way. Because when we start to see it that way, then we will start to make the kinds of alliances, and we will start doing this fight together versus having one fight over here and one fight here and one fight there. It's all, as Marcia said, the same fight. And so our ask, I was going to say, our ask is that you choose to get in the fight.
That's it. I agree. You get to determine where you enter. You get to determine where you enter the fight, but get in the fight.
You have to get in the fight. You can follow us. We'll give you lots of ways to engage in the fight. You can follow us on Facebook. You can follow us on Twitter. Follow us on Instagram. You can reach out to us. You have our email addresses, or info@theafiacenter.org. And Sarita has put the web address also in the chat. But follow us so that you can learn the different ways that you can enter and engage in this fight, ultimately for all of us to have reproductive justice.
Thank you. Thank you so much. I shared the same thought with Lauren, because I thought I knew so much, and what I've learned today, it's, we all need to join the fight where we sit. So thank you for this conversation. The report that for last year's report is on Black Health's website, and it's linked to the Afia Center's website. So, and Sarita also gracefully put the website in the chat. So please follow them, or you can also read the report and link to their website as well. But we are enjoying this partnership with Afia Center because Black maternal health has been least talked about lately, and we need to give it more volume. My child is crying. I don't know if you could hear it.
Oh,
But,
that's fine. That's
please,
perfect.
again, the struggles of a working mother. I apologize.
Yes.
Again, I
No,
put
no,
the link.
please. Don't apologize. That's perfect.
I put the evaluation link in the chat. Please complete it so we could bring you more of these conversations. These have been amazing. Masha, thank you so much for the partnership. Reverend Denise, thank you for sharing this knowledge with us. It's been amazing information, great knowledge that I believe I don't say it just by me saying it, that I've gained, and I believe everyone that joined today have joined as well. So thank you. And everyone, we will end here. Please complete the evaluation and enjoy the rest of your week.
Thank you.
Thank you.